Hello, my name is P.Garner, and I'll be talking about the clinical problem of an accidental needle stick injury with nurses. So, the initial question here is this is a clinical problem. What needs to be understood about a needle stick injury is that it is a 100% preventable clinical problem. This involves safe needle handling, knowing what you're doing, controlling your environment, and making sure that you're understanding the procedure from start to finish. So, the main take home point is that these injuries are 100% preventable. Unfortunately, nurses do have the highest incidence of this type of injury in the clinical practice. 38.4% higher chance of this incident happening if you're a nurse rather than any other healthcare provider or worker. A lot of these injuries occur when the nurse is recapping a needle. So it's important to remember the education that we learn along the way that recapping a needle is not something that we want to be doing because that is an unsafe practice and can lead to this preventable clinical problem. So some research has shown that out of every 100 needle sticks that we have as a nurse, 2.8% of those needle sticks will be an accidental stick, usually to the finger. So that's something to consider as well, into learning just how high the incidence of this problem actually is. So with the needle stick injury comes high risk for the nurse, including bloodborne pathogens. In that mix, you get HIV, hepatitis B, hepatitis C, other diseases that can cause actually direct harm to the nurse. So again, that being said, nurses do have the highest incidence of this problem, therefore making it a very large clinical issue that actually needs to be talked about. Moving forward in research, we also learn that the safety mechanisms that we'll be talking about today reduce the accidental needle sticks by 21%. So that's something to also keep in mind. So, what is the available research? Available research is going to include a regular hospital policy. What is being told to these nurses as far as what can we do to prevent these needle stick injuries? We go through extensive research as far as education, learning how to avoid these injuries. The safety mechanism that's been given for a needle stick has actually been known as a needle guard. So instead of having to actually recap a needle, there's actually a small guard at the end of the needle that the nurse can press down, which actually takes the touching the actual needle or the action of going from a needle into the cap takes that problem away. So the nurse just has to safely recap the needle using the needle safeguard and then properly dispose in a sharps container. Other available research, as nursing students, we go through extensive instruction and education about how to avoid these problems as a whole. So we learn that recapping a needle is not something that should be appropriate. We learn the safety features of the needle and how we should be able to avoid this issue with every patient. Again, this is a 100% preventable problem. So learning how to combat this issue is something that we've learned in nursing school that should be continued throughout the entire practice of our career. So there's a lot of available research about what we can do to make these changes. But again, that big one is the needle safeguard that allows the nurse to completely disregard recapping a needle with two separate hands or one hand approach. They just have to press that needle safeguard down that can help avoid that injury. So the next question is, how do I operationalize this change in my own practice? It's important to ensure that the sharps containers are where they need to be in each room. You don't want to be giving a shot, for example, across the room and have to walk entirely across the other side for a sharps container to properly dispose of that needle and syringe. So having the sharps container directly next to you can be something that helps instill that safety feature. I also want to make sure that we're talking to the patient. So we're talking to the patient about what we're going to be doing, how we're going to be doing it, if it's going to hurt, those types of things. Talking to a patient really does help with having the patient understand what's going to be happening, which then helps us limit movement, and they're more prepared for the procedure. That makes a safer environment for the nurse and the patient. Again, we're not going to be recapping those needles. This is one of those do's and don'ts with the needle. We're not going to be recapping with two hands. We can, one, use the needle safeguard, or if our our hospital or clinic does not have the needle safeguard. Again, that leads back to the sharp container placement here at the first bullet on the slide. Sharp container placement is huge, so that way you don't have to recap. You can simply give the injection, the shot, whatever, and then place into the sharps container bin close by. It goes into, the needle disposal. Something about needle disposal with looking at the sharps container is ensuring that the sharps container does not get past its maximum capacity. Injuries can still happen when a nurse is placing the sharps object, the needle, into the sharps container. If the sharps container is overflowing that maximum capacity, that does mean that the nurse has the opportunity to potentially poke his or her finger with the contents inside the sharps container, and that can pose as a problem. So making sure that we're disposing of the sharps container as we need to can also limit the injury of an accidental needle stick. So making sure we're not getting above that maximum capacity line. And then again, just one safety feature as well is just wearing some gloves and the proper equipment. Although a glove is a very thin barrier between the needle and the skin, it still acts as one safety mechanism that we can do. So having the proper equipment and proper tools to do the needle the safest is something that the nurse should be paying attention to. So into the theoretical model that I would be using, I'd probably use a quantitative research method. This can be used to understand what type of needle stick injury is happening most often in the clinic that I work in. So that way I can see, like, based off this research, I can come up with ideas on how to prevent a needle stick injury. So again, when we're out into the field, we should be looking for different opportunities to make things better and safer for both the patient and the nurse. So I can use that research of where I'm at. I can come up with different ideas about how to prevent this type of needle stick injury from happening so often. Now, one of the barriers that I probably will come up with this research is the nurse is not going to be reporting all of the needle stick injuries due to maybe embarrassment, fear of their job, what their coworkers are going to be saying, what the higher ups are going to be saying, are they reporting it to OSHA, those types of things can potentially be a barrier because the nurse is probably embarrassed that they've gotten stuck by a needle, which can propose as an issue because then that nurse is put at risk for those bloodborne pathogens that we discussed at the beginning. So that's something to keep in mind as well. To overcome this barrier, what I would do as a researcher is probably just make it an anonymous study to address the group during education, making sure that I'm not singling anybody out in this type of research. So in one of the particular studies that I looked into when discussing this theoretical model was that 28 out of 88 accidental needle stick injuries were properly reported to the correct place. So that tells us that there is a problem with the reporting that should be definitely looked into as something that we can improve as we go into practice. And just learning that anonymously we can report a needle stick injury, yes, but it is important for the practice and the clinic to know what has gone on, why was there a needle stick injury, and those types of things. So that's something that a barrier that we can cover is really just that embarrassment factor that the nurse can go through by not wanting to report the actual injury itself. So that's something that we need to be aware of. So looking at some internal evidence as far as what we'll see out into the field, these can be used, the internal evidence sources can be used to demonstrate improvement as far as the documentation, like I just mentioned. If only 28 out of 88 accidental needle sticks are being reported correctly, that needs to be something that I can improve in my observations. Again, looking where those sharps containers in various different areas of the hospital are placed. Are they at their full capacity? So those types of internal evidence can help me to decide what route my research kind of needs to go. Also, how is that needle stick being reported? Is it anonymous? Is it to your clinical supervisor? Is it to this person or this person? Internal evidence needs to be taken into account as far as how things are being done, and the proper education and learning how to report that injury and the why behind reporting that injury can be something that can hopefully push the nurse to want to, one, stay safe when handling a needle, two, not wanting to report it, but learning how to properly report it when that problem actually occurs in their own practice. So ethical considerations with this accidental needle stick injury. So the ethical considerations include anything with HIPAA. You're talking with your friends, of course, say I had this needle stick in, room 302 or whatever's happening. Those certain things should not be happening because that does help support a HIPAA violation. So the nurse who gets stuck by a needle, this nurse needs to get labs completed. This is important for the nurse's safety as well, because the patient may have that bloodborne pathogen or something like that happening. So the labs that the patient needs to be done and get done help the nurse to understand if they're at risk for something and what medications they should start or not start, what treatment plans they should start for this type of trauma. So let's say the patient does not want to get the lab done. Is it ethical for the nurse to go get the labs done after the patient says that they don't want to be doing that anymore? They don't want to be getting their labs completed. So can the nurse perform these labs without getting the patient's consent? The truth is, this is an ethical concern because the patient has the right to refuse, but the nurse has the right to his or her safety as well. So it becomes this like catch-22 situation, which definitely is a problem and an ethical concern, because as a nurse, you're going to want to be doing as much as you can to keep yourself safe from these situations as well. So learning that the patient has this type of bloodborne pathogen or this type of history can help the nurse understand that their needle stick injury could potentially be a problem for them. So that's one of the larger ethical concerns. So what should you do? Normally speaking, a patient is going to be willing to get those labs done because they understand that it's for your safety as well. The nurse should be educating the patient about this type of consideration, that the nurse should consider, or the patient should consider, that this is for the nurse's safety, not for the patient's safety, those types of things. I have seen one accidental needle stick in my own nursing practice so far. My boss was working an EMG needle, and the patient kept moving, and she ended up sticking herself right in the finger because the patient had jumped during the procedure. So one of the main points that I like to hit was really talking with the patient and telling them what you're going to be doing, why we're doing it. It's important for them not to move, those types of things. So that's one of the key pieces that I took out of an accidental needle stick, is really preparing the patient for what's going to be going on, why we're doing this, how they need to remain still, and making sure that we're doing everything that we can to prevent the accidental needle stick. So this type of injury is crucial in the field. We've learned that 2.8 out of every 100 needle sticks is a very large number. And when you really think about that, that's a very large number, which means these injuries happen quite often. So learning to control your environment, control the patient, control your reaction to something is something that nurses need to pay attention to in their practice and kind of create that art of of making this problem less of a concern. Some take-home points is that this really is a preventable injury, and with proper education, training, and learning the safety mechanisms that the needles can have, including the safety guard, and then reviewing the hospital or clinic's policy that you're working for, really can help to avoid this accidental needle stick injury. So this is my reference for my pictures used, and I hope that this was educational for you and you've learned that needle stick injuries can be preventable, and we can do everything in our power to make this incidence level go down. Thank you.